Hey everyone, it's John Finnoff here, and I'm sorry that I had so many problems technically with my presentation earlier today, so I'm just going to record it this evening and hopefully you enjoy it. I'm doing this from my Airbnb because I have a little apartment that I'm staying in until we get a home here, but without further ado, we'll move forward. So I'm going to talk to you about the USOPC's response to COVID-19. My disclosures aren't relevant to this particular presentation, and I'm going to start off and talk to you about an overview of the problem, what our response has been, and then I'll talk a little bit about our reentry plans for getting people back to training and also opening the Olympic and Paralympic training centers. We'll draw some conclusions on that information. So, from an overview standpoint, I know all of you are very familiar with the coronavirus. It's a family of viruses. It is found in both humans and animals, and it causes respiratory infections. And the current outbreak occurred from SARS-CoV-2, and it causes an infection called COVID-19. Most likely the reservoir was from bats, and there was some animal transfer into humans, and they don't know exactly what that animal vector was. So on December 31st, this mysterious pneumonia was first reported out of China, and it was connected with the Hunan seafood wholesale market in the Wuhan city of China. By January 7th, they had actually identified the virus as SARS-CoV-2. By January 11th, the first death was reported from this disease. January 20th is when the first case in the United States was reported. By the 30th, the World Health Organization had declared a global public health emergency. But between the first case on January 20th and February 29th, only 59 cases actually were documented in the United States, and the first death occurred on February 29th. So everything ramped up pretty dramatically from there. By March 11th, it was a world pandemic. And so the World Health Organization considered it at that point a global pandemic. On March 13th, the U.S. declared a national emergency, and by the 26th, we had surpassed every other country in terms of number of cases of COVID. By April 7th, we had the largest in the world single-day death count, and it became the leading cause of death in the United States. By today, April 25th, there were 2.8 million cases worldwide with nearly 200,000 deaths. In the United States, we've almost gotten to 1 million cases, and we're at 52,000 deaths. So just to give you an idea of how fast this occurred, between the first case and the 100,000th case that was diagnosed, it took 67 days. But to go from 100,000 to 200,000, it only took 11 days. And then to go from 200,000 to 300,000, 4 days, and from 1 million to 2 million, 13 days. So this is incredibly infectious, and it just had this amazing exponential curve as it infected the world. Now, if we go back to the slide in March, so remember February 29th, there was the first death in the United States and only 50s number of cases in the U.S. Well, I started my job at the USOPC on March 2nd, so right after that. But then, boom, things just started happening fast. The World Health Organization declaring the global pandemic. We had a national emergency, and by the 24th, the 2020 Tokyo Olympic and Paralympic Games had been postponed to 2021. So things really happened fast at that point. And just to talk a little bit about the USOPC's response, it began before I was here. So on January 30th, the USOPC issued their first communication about COVID-19 to the national governing bodies. And by January 31st, they had formed a COVID-19 working group. Initially, that was only 4 members: medical security, risk, and sports performance. But by the 23rd, there was by now, it's 23 members on that group, including myself. So it's really grown quite a bit and has representation that's broad from the USOPC to address this issue. So after I started on March 2nd, obviously things were ramping up really quickly. So I created an infectious degree advisory group. with a high-ranking individual from the CDC who felt like he didn't want to have his name publicized, and then several leading experts in infectious disease throughout the country. And we developed a workplace preparedness plan for COVID-19, and it was based on not only our infectious disease advisory group's recommendations, but also the World Health Organization and CDC's guidelines for workplace preparedness. So, the first thing that we wanted to do is educate our staff and communicate what we were doing to our staff, our athletes, and anybody else who was planning on coming to the US Olympic and Paralympic Committee. We didn't want to have any exposure of our athletes and staff to people just coming in to check out the Olympic and Paralympic training centers. So we discontinued tours. We wouldn't allow any visitors to come into the site. And we encouraged our staff to begin working remotely. All of our staff international travel was canceled, and we would only approve essential domestic travel, and it had to go through an executive committee review process. So they were really, really strict. They didn't want people going out and traveling and bringing back COVID-19 into the workplace. We started an intense cleaning protocol for our facilities and a screening process for everyone. So essentially, we had people doing twice daily self-monitoring for signs and symptoms of COVID-19. And when they came through security, they would be asked these questions: do you have a fever? Do you have shortness of breath? And so on. So the different signs and symptoms of COVID-19. And then we, of course, implemented general infection measures. So we had hand sanitizer everywhere. We had social distancing at work, even though most people were starting to telecommute at that point, and so on. Within sports medicine, we also developed a protocol. So when an athlete would start feeling sick, and they were doing their twice daily self-monitoring on an app that would send them a program or a set of questions each night and each morning that they would answer. And if they had a positive response to a sign or symptom of COVID-19, then they were instructed to call sports medicine. We would do the history and physical over the phone. We would have one of our medical personnel then go and escort the person back to the sports medicine center wearing PPE. And of course, the athlete would be placed in a face mask. We would complete a physical examination, do a biofire respiratory panel, which essentially is a PCR panel for common pathogens of respiratory illness, and then also get a COVID-19 PCR. And we would place them in quarantine until we got the results of our tests. So further dates on March 16th, because of state mandates in California and Colorado, and also in New York, we closed down our training venues in the Olympic and Paralympic training centers. But as you mostly know, there are a lot of athletes who live here. I mean, they call the Olympic and Paralympic training centers their home. And so we didn't kick people out. If they lived here and they didn't want to leave the site, then we kept them here. We ended up with about 20 athletes in Colorado Springs, 10 in Lake Placid, and 60 in Chula Vista, which is San Diego, along with 50, 15, and 30 staff, respectively. So we had about 185 people that were regularly on site. And so with all of the measures that we implemented, we actually only ended up with 3 confirmed COVID-19 cases of our resident athletes or staff in any of the Olympic and Paralympic training centers. And then we had one who was not a resident athlete, but they lived in the community and were around a lot of our other athletes and had access to the site. And so they exposed several of our athletes. Thankfully, that none of the athletes who lived on the training center, we did quarantine them, but none of them developed COVID-19. We have had a total of 10 athletes who were quarantined throughout the 3 sites with suspected symptoms or close sustained exposure to people with COVID-19, none of whom ended up testing positive. So, we had this successful plan that we implemented. We felt very good about it. We were taking good care of our athletes. But now, of course, we have to start thinking about what are we going to do after these restrictions are lessened. So as we're not doing shelter in place anymore, and we're starting to allow public facilities to reopen, we have to have a plan in place. And this is also a huge deal, not just at the Olympic and Paralympic training centers, but for athletes, coaches, NGBs. Everybody was asking for guidance. How do we return to training? How do we start planning events? And so with them asking me a lot about that, I wrote an initial document and then widely circulated it with a group of experts. So people, it was a broad group. So athletes, leaders in national governing bodies, chief medical officers for collegiate and professional sports, people from the CDC, infectious disease doctors, public health officials, and so on, and got a lot of feedback. And boy, the document really evolved as I worked on it. And we came out with 2 different documents that are going to be released on Tuesday. The first of which is a sports event planning consideration, and the other one is a training, return to training consideration. Just because of time constraints, I'm only going to talk about the return to training document. And so for the return to training document, this, I have a preamble, and essentially it says that this is not meant to be prescriptive. It's a guide meant to be used by sports as varied as archery and wrestling in locations as diverse as Minot and New York City, by athletes and organizations with vastly different resources. So it cannot be prescriptive. Essentially what has to happen is the governing body or the athlete has to take this information and try to interpret it to their own situation. So it has to be sports specific, location specific, and resource specific. And I also wrote in there that there are ethical considerations. You know, if you start training and you do this as a group, are you putting the community at risk? Is the healthcare system ready to handle another outbreak? Do you have access to testing? And if you do, are you pulling that testing away from people in the community who need that testing? What if you start using PPE? I mean, shouldn't that be used by healthcare professionals because there's a worldwide shortage of a lot of PPE? And then if you tell an athlete that they can't participate in a group activity because they have symptoms or you're doing testing, then that is excluding an athlete from participating in sport. And athletes have a right to participate in sport. And so there's all these different ethical considerations that people really need to think about. And while the population that we're taking care of is young and healthy, you know, any infection, even in the young and healthy, can be fatal. So we're not talking about an ankle sprain. We're talking about something that can kill you. And so until COVID-19 is either eradicated, a vaccine is developed, or a cure is found, there's no way to completely eliminate the risk of fatal infection. And that should always be on the forefront of your mind when planning return to training or an event. So that is right off the bat in the document, and it's something that I think is really super important for people to think about. So for the return to training, we set it up in a 5-phase system. So essentially, in phase 1, you're in shelter in place. Phase 2, they start allowing people to leave their homes, but they still don't want any groups to be participating in activities. So you're doing virtual coaching, you're training on your own with your own equipment, and so training facilities are closed. Phase 3, they start allowing people to get together in groups of 10 or less. They still encourage social distancing. Facilities aren't opening. So at this point, in the documents, which will be released on Tuesday and you can go through, but essentially we recommend that you go through a process where people shouldn't be symptomatic for a period of time. They shouldn't have traveled from other areas, because if one area is opening up and reducing their restrictions, it doesn't necessarily mean that another area has, they may still have a lot of community transmission of COVID-19. The other thing is that if you travel by plane, you don't know who's on that plane. I mean, it might be people from the highest areas with the highest prevalence of COVID-19. So you really should be in the location where you're training for a period of time before you get together with a group of people. But we certainly recommend in phase 3 that you continue with infection control measures. You should do signs and symptom monitoring twice daily. You should, if you feel sick at all, you should not be going to these training sessions. And you shouldn't have any direct or indirect contact. And what that means is direct contact, you don't want to be wrestling or doing any type of combat sports. Even basketball, there's a fair amount of direct contact, but also indirect contact. So if you are out there playing volleyball and you're sweating and you're holding onto the ball and you wipe your hand across your nose and then you put your hands on the ball and then you hit it and the other person hits it, you may not have hugged that person, but boy, you may have gotten a really nice dose of COVID right there because of the respiratory particles that essentially the mucus particles of virus that you've put on the ball, and now it's exposed to other people. So no direct or indirect contact. The coach can be on site, but they need to be doing social distancing. At that point, in that phase, people should be wearing a face mask if they're close together, and if not, then they don't have to wear facial coverings. Phase 4, training facilities open. They don't have restrictions on group size anymore, but we would still recommend the same group selection process. So people who have been in the area, they're not traveling from outside, they don't have any signs or symptoms of COVID-19. You could do testing if you want. That's more expensive, and so it's resource specific. And the second you're out in the community, the test that you just had doesn't make a difference. So you have to have those people in a sheltered and protected environment away from places where they could get infected. You should do twice daily monitoring for signs and symptoms. But at this point, if you're allowing people to get together in groups, you're assuming that there's very minimal community transmission, if any. And while you should try to do infection control measures like avoiding sharing equipment if you can, at this point, this is when you could start sharing equipment. You could have some direct and indirect contact. Now, at phase 5, that's when a vaccine or cure is developed, and essentially people can go back to normal activities. But all of these infection prevention procedures that we've learned and hopefully have become habits, you should continue to do. So wash your hands a lot, cover your cough with either a facial tissue or into your elbow. So doing different things that minimize infectious disease, because even if we find a cure for COVID, there's influenza and all sorts of other things that you can still get. So you just should be following general infection control procedures. Now, reopening the Olympic and Paralympic training centers is a facility, obviously, and so this is a pretty complex process. So what we're going to do is when restrictions are reduced from a public health standpoint such that we could potentially open the facilities, 5 days thereafter, we're not going to let athletes on, and we're going to get staff in place. We're going to do a deep cleaning of all the facilities and living spaces so that we're ready when people come back on. And we're going to be very gradual with the athletes that come back on. We're going to choose sports, athletes that are participating in sports that are low risk. And we also want to have low numbers at first. You don't want to pile a ton of people in and find that your procedures are not working. So here is a little risk chart that I came up with, but it makes sense. So high risk sports are those that have close sustained contact with no protective barriers. So taekwondo, rugby, judo, boxing, and so on. Moderate risk, you have close sustained contact, but you have some protective barriers, or it's only intermittent close contact, such as group sports, or sports that use equipment that can't be cleaned between athlete use. So different examples of this are bobsled, doubles luge, multi-person rowing, basketball, hockey, volleyball, baseball, soccer, and so on. Low-risk sports are ones that can be done with social distancing or individually, and there's no sharing of equipment, or you can clean the equipment between competitors. So archery, shooting, skateboarding, sport climbing, and so on. So we choose the sport that's lowest risk. We start off with teams that are smaller in number, and they're going to be resident athletes. So they're moving into the Olympic and Paralympic training centers. So prior to arrival, they'll get information that talks to them about what we're doing to try to alleviate their risk once they're on site. So it hopefully helps reduce their anxiety about coming and being in a group situation. So we'll really educate them on that. And we'll also really talk to them about the procedure that they're going to go through. And so I'll kind of walk you through that procedure prior to arrival. They are going to be sent on their cell phone. They're going to receive a little text message that they'll click on a link, and it'll ask them questions about COVID-19. After they answer those questions, it'll pop up a QR code, And when they arrive at security, they have to scan, the security officer will scan that QR code and it'll say yes, enter, or no, because they're symptomatic. It'll also tell the athletes what to do if they are having symptoms. We'll also have a heat camera that'll check their temperature. So if they're asymptomatic, they have no temperature, then they are escorted by staff into a quarantine area. In the quarantine area, they'll have single rooms, their own bathroom, and they're going to get 2 sets of PCR testing from nasal swabs. The tests will be 24 hours apart, and they'll also get serology. And the 2 COVID tests are essentially, if they have 2 negative tests, then that's a very high likelihood that they do not have COVID-19. And so that person would then be introduced into the Olympic and Paralympic Training Center. So they'd be removed from quarantine. We're anticipating that's going to take about 48 to 72 hours. If they have a positive test, then of course they need to be quarantined until they either develop symptoms and their symptoms resolve, and it's been a minimum of 7 days with 72 hours symptom-free. So just following the CDC guidelines. If they never develop symptoms, then we'll give them 7 days of symptom-free, and then we'll retest them. And essentially, anybody who has positive tests, not only do they have to be symptom-free, but they have to do a 2-test protocol with a PCR test to make sure that they are negative. The serology is more for understanding the epidemiology of how many of our athletes have been exposed to COVID-19. We're also going to look at what percentage of those athletes were symptomatic at the time. So we're going to collect some information on that. And while you can't interpret it at this point and make clinical decisions, because we don't know whether serology indicates, in the presence of antibodies, we don't know whether it indicates that you're actually immune. And so we're going to hold on to that data. We'll certainly let the athletes know. But we're hoping that as we get more knowledge, we'll be able to go back and tell the athlete, yeah, you had your test, it showed that you've had COVID-19 in the past, and we know that that doesn't actually protect you from future infection, or you're not going to have a future infection because you have high immunity. So as scientific knowledge advances, we'll be able to use it to educate our athletes more. So now they're inside the Olympic and Paralympic Training Center, and we'll have a whole set of procedures there where the coaches will have developed protocols for training that will be approved by our COVID-19 working group. And essentially it will be small group training. People will be scheduled for certain shifts when they're going to train. All the equipment will be cleaned between uses by athletes. And we'll do all of the standard infection control measures associated with that. Everybody is going to have a facial covering, and so anytime they're outside of their room, and their rooms they'll be in a single room with a single bathroom. But anytime they're outside of their room, they will be wearing their facial covering. They'll be given hand sanitizer. There will be hand sanitizer dispensers all over the place. There will be posters explaining what they should be doing. In the cafeteria, we'll again have scheduled times to go and eat so that we minimize the number of people that are going there. We'll have tape lines on the floor at the entrance so that you have to maintain social distancing going into the cafeteria. Only a certain number of people will be getting food at once. It'll all be served by servers as opposed to you serving yourself, so that people don't have to repetitively touch cafeteria silverware, serving spoons, and so on. And then in the actual seating area, we'll only have the right number of seats at each table so that social distancing is maintained. Obviously, if anybody, and we're going to keep people always in the same groups so that if one person does get sick within that group, it minimizes the number of contacts that they've had. Now, while this is all really good, and we believe that it really is going to reduce the risk of somebody getting infected, it's not a pure system. There are still going to be staff coming in and out. They are going to be screened. They're going to be doing self-monitoring, but they're not going to get tested for COVID-19. And so people can get sick and they can transmit disease. But we're going to try to create a big separation between the athletes and the staff so that there's not commingling and it reduces the risk of transmitting infection. That along with the intensive cleaning. So we're excited about it. We think we're going to do a good job with it. But despite our best efforts, it's certainly possible that somebody can still get sick. So in conclusion, COVID-19 hit us hard and fast. It was certainly in the back of my mind when I started, but I did not realize that this was going to be what I've spent almost all of my time on since I've been here, that and mental health. But the response that we've done, I'm very proud of it. It's been dynamic, multifaceted. It's often related to the rapidly changing public health mandates, and literally those changed hour to hour, and they changed. San Diego was different than Lake Placid was different than Colorado Springs. So keeping on top of all of that was really important. We've got a broad infection control strategy that we implemented, and I believe it was successful based on the number of cases that we had and the fact that we didn't have a big breakout in what would be considered, high density living. So I think it worked out well. We have a very challenging path ahead, though, with reentry post-COVID-19 because we don't have immunity that we know of. We don't have a vaccine. We don't have a cure. And so as we lift restrictions, there are very likely going to be waves of reinfection. And so we're going to do the best we can to keep our athletes safe and our system as pure as possible. The USOPC, I really want people to know that we're here to help you. This is a really, really complex time. And so the documents that we're creating for return to training and event planning, those will be released again on Tuesday of this week. And then we're also the Olympic and Paralympic Training Center reopening protocol and even our headquarters reopening protocol. I'm hopeful that we'll be able to publicize that as well so that people can look at them and use them to help with their own plans. So that wraps things up. I really appreciate your invitation. I hope that you found it informative, and if you have any questions, you're welcome to email me. My email address is Jonathan, JONATHAN .Finnoff, FINNOFF at USOPC.org. Thank you so much and have a great evening.